Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, a team of Israeli experts now in the country to help fine-tune the government's COVID-19 response and vaccination program. Also, the government signs a supply deal of 40 million doses of COVID-19 vaccines with Pfizer. And later, the World Health Organization is sounding the alarm on the Delta COVID-19 variant threat first detected in India. Do we have enough safeguards in place? National Task Force COVID-19 spokesperson Restituto Padilla and infectious diseases expert Rontgene Solante join us live. Following Israel's success in its COVID-19 vaccination program, the Philippine government is tapping some of their experts to share best practices. Meantime, the government has signed an agreement with Pfizer to buy 40 million doses of COVID-19 vaccines. Let's go straight to the source of the story. First off, we have National Task Force Against COVID-19 spokesperson, retired Major General Restituto Padilla. General Padilla, welcome to The Source. It's so good to see you again.
Thank you very much, Pinky, for having us. And good morning to everyone.
So I want to start with the arrival. Thank you, sir. I want to start with the arrival of the health experts from Israel. So we want to be able to get and find out from them their success. Initially, what is it really that, what is it you think that the experts can actually help and contribute to our COVID-19 response?
Well, first off, Pinky, they bring a lot of best practices with them, especially coming up from a very robust and very quick national inoculation program and rollout that they had in Israel. Actually, we've approached the numbers that they have been working on in the entirety of Israel. Kasi 8 million tayo ngayon, na nabakunahan. But in their case, I think that was the number that they aimed for. So they also used a vaccine from Pfizer. And right now, following the signing of the agreement yesterday for 40 million doses of Pfizer, and a mass rollout that may happen by the time it is delivered by August. We need to learn a lot from their experience, especially with Pfizer and the cold chain logistics that will come along with it. So there will be discussions with our own national task force, especially the national vaccination team that is working out to iron out details and facilitate the inoculation program that will be conducted in Capital today. They will also visit a provincial destination to check on logistics, as well as meet up with the United Nations and WHO representatives in the country. So by and large, whatever they learned in Israel over the entirety of their mass rollout of vaccines and the vaccination program will be beneficial to the Philippines. And that is exactly what we want to get out of this collaboration.
You pointed out one very good area, of course, as you were discussing this, because of the 40 million deal or doses of Pfizer vaccine. You were right, General, that what is being used or what is being used in Israel are actually Pfizer and Moderna, which require a storage facility of about minus 70 to minus 80. But that is something that already the government knows, is it not? The Philippine government knows. In fact, that's why the rollout of the Pfizer vaccines here in the country are in areas where there is that particular cold storage facility. That hindi ho ba para ma... Go ahead, sir.
Yeah, that's correct, no, Pinky. So we've made provisions on being able to roll out properly with minimum wastage the Pfizer vaccine. But there might be room for improvement in whatever we're doing, because the extensive experience of Israel for the rollout of Pfizer, and at the same time, the unique experiences they have, because they have a very robust health system. So we can extract lessons from whatever they're doing and whatever they have in terms of infrastructure, their reporting system, their monitoring. Kasi electronic na sila. They've been digitized a long time ago. Their health system is very much a digital platform already. That's why I guess Pfizer opted to provide them this bulk of vaccine so that they can follow through with the effect on the population. So this and all are part of the things that we want to learn from our Israeli friends who have come to the country yesterday.
And I did read General Padilla that they have in Israel what is called us, where they give or grant more freedom to those individuals who have actually been vaccinated. Maybe that's also something we can learn from them, because right now, all we have really are vaccination cards coming from different LGUs, of course, depending kung saan ka nagpa-bakuna.
That's right. Yeah, that's correct, Vicky. Kaya I mentioned the digitalization that is involved. So definitely with the way that they have been running the inoculation program in Israel and the way they have been reporting and following through and monitoring everything, particularly who among the population and the level by which they have started to ease up and provide a greater latitude or degree of freedom of movement for those who have been inoculated. So maybe they have parameters that they can share with us that we might not have yet had in our books or considered in our books. And definitely this will add to our body of knowledge that will help us further expedite, make more efficient, and increase perhaps the number of vaccines that we can do in a day. So last June 15, we already reached 355,000 inoculations.
Yes.
So we're aiming to have 500,000 to 0.7 million per day. So they might have lessons that they can share with us to further bring those numbers up.
Yeah. And one good thing also to point out is that they have fully vaccinated about 56% of their population, fully vaccinated. That's about 5 million, if I'm not mistaken, 5 million individuals. And then the other 5 million have already, I believe, been administered their first dose of vaccine. But comparing Israel to the Philippines, mahirap din po in one way because of the population disparity. You have Israel na di hamak na mas maliit po ang populasyon kumpara sa Pilipinas. Ano po?
Tama yan, Pinky. Kaya nga, mas malaki yung hinaharap nating mga challenges at mas malaki yung bilang na tina-target natin. Kaya kung ano man yung matututuhan natin sa kanila, parte na rin yan ng kanilang maipamamahagi. Kasi I guess the whole world is looking at the Philippines. Kasi unique tayo katulad ng Indonesia sa bilang ng mga babakunahan natin na kukumpara mo nga sa bilang nila, gagasino lang. Kaya kung pag-uusapan natin yung nabakunahan, na bilang, at least na-achieve na natin kasi yung 8 million na first dose at 2 million na approaching at pahigitan pa natin yung pangalawang dose. So kung ano man yung maipabahagi ng Israeli expert na mga ito sa ginagawa natin ngayon, sigurado kami na madami tayong makukuhang aral at mapulot.
Okay. But on one more question on this, General, I'm not sure if you'll be able to give us an update. Doon po sa possible donation ng bakuna galing sa Israel. Any update or information on this, sir?
This was diplomatically arranged and it was a discussion that was made by the vaccine czar. So far, hindi ko lang po alam kung ano na po ang sitwasyon ngayon din sa pag-uusap niyan. Pero yun po ay manggagaling sa kanilang sobrang inventories, yung hindi na nila kakailanganin na pwede nilang i-share. So maaaring itong team na to ang siyang magbibigay din ng rekomendasyon pagkagaling nila dito sa kanilang gobyerno tungkol sa donasyon na yan. So umaasa kami na matapos na nagkaroon tayo ng kolaborasyon na ito at yung mapupulot din siguro nilang aral sa atin, masusuportahan yung request natin na madagdagan pa yung mga bakuna natin na manggagaling din sa kanila.
Shifting topics, doon po sa mga individuals fully vaccinated dito po sa ating bansa in the Philippines. So people who are fully vaccinated in the country will be allowed to actually shorten their quarantine period to 7 days. Nang pushback po ito, kailan na ho ba siguradong mag-uumpisa itong 7-day quarantine?
Yung 7-day quarantine ay mag-a-apply initially sa mga nabakunahan po sa Pilipinas. So ibig sabihin po nito, yung mga nakadalawang dosage na at nakalipas na po ang 2 linggo, sila po yung considered na fully vaccinated. So meron po tayong system para ma-verify po at magarantiya na yung pagbabakuna na yan ay tunay na nangyari. Ngayon, yun nanggagaling po sa ibang bansa, wala pa po tayo kasing kakayahan na i-authenticate or i-check ito. Kaya nagkakaroon ngayon ng usapan, lalo na sa Estados Unidos, kung paano natin magagawa na mapabilis yung pag-verifika nito para sigurado tayo na yung mga dumadating dito na nagsasabi, lalo na po yung mga Pilipino na kababayan natin na nabakunahan sa ibang lugar, ma-check natin na tunay na nangyari yung pagbabakuna sa kanila. Kaya ang hakbang na ito ay ginagawa lang naman po natin para siguradong hindi po tumaas yung bilang na nagkakasakit, lalo na po may mga bagong variant ngayon. The new variant, especially the Delta variant, which originated from India, is a variant that spreads quickly, faster than the previous variants that we have come to know. So ito yung iniiwasan kasi pag napasukan po tayo, mahihirapan pong makakope yung ating health system sa bilis ng naahawa niya at yung mga naapektuhan. So nakita naman po natin noong April kung anong matinding naging epekto nito with an almost overwhelmed health system.
But yun pong individuals fully vaccinated in the Philippines that will begin the shortened quarantine period na 7 araw po. Kailan po ito mag-uumpisa?
Actually, ina-apply na ito, no? I think the effectivity was 16, but the guidelines and the implementing arrangements with the other agencies are being finalized. So hopefully, this technical working group working on this will now extend the coverage of these guidelines as soon as we get authentication from other countries to those traveling from other countries who have been inoculated in other areas. The current guideline only applies to those vaccinated within the Philippines. So,
yes.
nagsimula na po yan. Pero yung sa mga galing po sa ibang bansa, hindi pa po.
I see. Because ang huli ko pong nabasa, dapat 16 po yan, pero na-move ata ng June 22. Yung Filipinos, yung individuals that are vaccinated here in the country. I thought that was pushed back to tomorrow.
In the Philippines, yes.
Yes. Yes.
Yes.
So you're saying...
there were others who were not able to adjust kasi hindi pa po naabisuhan yung mga LGUs at saka yung DICT. Kaya nag-adjust po. Pero may ilan-ilan po na nakakomply kagad. Kaya yung kanilang pagbabalik ay maiiklian na sa 7 araw yung kanilang kwarantina. So we will continue to come up with this guideline so that it will be easier for everyone to understand. And at the same time, yung mga agencies concerned na meron pong ambag sa authentication process na ito o pag-certifika ay mapapabilis din ang kanilang mga proseso. Kaya po yung anunsyo na yon ng 22, maaaring dun po mag-a-apply. But there were those who were able to comply, if I may say that.
I see. So ano hong kailangan? General, kailangan po yung vaccination card. Is there also a document that they need from the DICT?
The 2 agencies of concern will be the DICT po na siyang nagiging repository po ng ating mga data ng mga nabakunahan na. At yung pangalawa po ay yung LGU through their municipal health officers who are administering the vaccine. So the certification initially that was required of the travelers would be from any of these 2 agencies. So the LGU concerned may come up with the certification because they have those data if these are their constituents. But for the national data center that is run or managed by DICT, sila pwede rin po mag-issue. Ngayon, dito po yata nagkaroon ng konting adjustment dahil hindi pa po nakaset up yung system na yun, lalo na po sa DICT. But the LGUs, I think, some of them were very much on the ball. They were able to catch up and do it.
Did I hear you right, General? It's either or do they
Come again,
need
Vicky?
both? Do they document? Um, did I hear you right? Isa lang ho bang kailangan para dun sa mga individuals vaccinated here for the shortened quarantine period? Yung vaccination card lang ho ba galing sa LGU or yung DICT certification or both?
Either or. Based on the guidelines that I saw and I read, DICT certification and the the LGU. So kung may isa na silang certification galing sa LGU kasi sila naman na nag-administer at ginarantiya ng LGU na nagawa yung pagbabakuna ng individual na yon, sapat na po yun. At hihingin po yan sa airport bago po kayo umalis. At tatanungin po yan at checkin nila sa pagbabalik nyo. Kaya yung pagbalik nyo, hindi na po kayo i-require na magkaroon ng mas mahabang kwarantina. So 7 araw po pa rin. Pero hindi na po aabot ng 10 araw.
National Task Force Against COVID-19 Spokesperson Restituto Padilla. Sir, maraming salamat po sa inyong oras.
Maraming salamat din, Pinky, sa pagkakataon. At please stay safe and stay doubly safe, even if you are vaccinated already, because this is the number one protection we have. Wear the mask, wear the face shield, avoid public places, and to continue sanitizing. Thank you.
Thank you, sir. And this is The Source on CNN Philippines. The World Health Organization says the Delta COVID-19 variant is on track to become the world's most dominant variant. Are we ready for it? Infectious diseases expert Rontgene Solante will be with us after the break. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, infectious diseases expert, Dr. Rontgene Solante. Dr. Solante, good to have you again. I'm going to start my question already. In Indonesia, that report that came out that over 300 healthcare workers were infected with COVID after receiving Sinovac. Let's just get more data on this that you know, because from the DOH's side, they're saying that let's be careful with this news report with such data, because we don't even know, is it one dose? Has it been, were they given the second dose? At ilan ho ba talaga to in totality? What do you know, Dr. Solante, so far?
Yeah, I think we need to validate the report on this vaccinated healthcare workers in Indonesia, no? And all those inquiries are not yet been answered based on a peer-reviewed article. These are just media releases, and it's very difficult to interpret a media release without the verification of the number of cases, including the number of those vaccinated, which is really important in order for us to compute for the efficacy of this effectiveness of this vaccine. So we don't want to surmise that this vaccine is not effective against COVID. We still believe that it's highly effective against COVID, and it's just a matter that they reported that these cases are among healthcare workers, which is also the highly vulnerable among this population. And
Absolutely.
For me, I don't have any doubt that Sinovac is still a good vaccine.
Okay. You want to be more cautious as the DOH is in interpreting this data, ano po, because it's subject to many interpretations. With over 300 healthcare workers infected, again, there's that factor that needs to be inputted. Gaano kadami hubang healthcare workers yung na-vaccinate ng Sinovac? Okay, so while we don't have that right now, you're still, of course, saying that you believe that Sinovac is very effective. Let's go to one subject that we've talked about in the past. Ni ho ba, there were a number of clinical trials on Sinovac. One was from Brazil. And I believe, if my memory serves me right, yung Brazil po was the one that looked into healthcare workers injected with Sinovac. And that gave about a little over 50% protection. Vis-a-vis the clinical trial in Indonesia that gave a much higher percentage, I believe over 90%. But this was across the board. Kumbaga, hindi lang po to health workers ang kanilang pinasok sa clinical trial. My question, Dr. Solante, is, does this give credence now to that Brazil clinical trial saying that it was 50.4, I think, percent effective?
Sorry, Pia. Again, Pia. I didn't get your question.
You didn't hear me, Dr. Solante?
Yeah.
So-
Kindly repeat the question, Pia.
Pinky, sir. Sir, kasi naalala niyo yung Brazil trial? Hindi ho ba yung may clinical trial ang Brazil on Sinovac and there's an Indonesian clinical trial on Sinovac? Hindi ho ba yung sa Brazil? Ang lumabas, healthcare workers kasi yung kanilang clinical trial. Ang lumabas po doon, di ba, just over 50% ano siya, protected?
Yeah, correct.
So I guess ang tanong ko po, doon ho ba, does this mean na tama, accurate ang naging clinical trial sa Brazil? Kasi nakikita po natin na hindi ho ganon ha, protektado yung health workers sa Indonesia.
Yeah, but if you look at the clinical trial, it's the 50% in the prevention of the overall, including mild, and mostly the mild cases. But what was the other advantage of that clinical trial in terms of the COVID Sinovac was that it prevented almost 85 to 100% of the severe COVID.
Severe.
And that alone, yes. So that alone for me is very important, particularly as healthcare workers, but because that is what we want to mainly prevent, getting hospitalized and getting the severe COVID.
I think it's really good to underscore that, no, Dr. Solante. Kailangan po natin maalala na yung vaccine is here to help prevent severe and critical cases. It does not mean hindi tayo magkaka-COVID. Ang sinasabi lang po, hindi tayo dadating dun sa pinakamalalang COVID kapag na-vaccinate tayo.
Yes, tama yan. No? Kasi unang-una, nandun tayo sa hospitalized COVID or severe COVID. That is really the people that will really occupy the healthcare facility. So yun yung pwedeng metrics natin na pag nabakunahan ka, hindi ka magka-severe, hindi ka magka-hospital, hindi mapupuno ang hospital natin dahil nagka-COVID ka.
All right. The next question would be, should we ban more countries with cases of the Delta COVID-19? A very short break. The source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, infectious diseases expert, Dr. Rontgene Solante. Dr. Solante, do you think we should look into banning more countries kung saan nakikita na, natatagpuan, or prevalent ang Delta variant?
Well, I'm not totally for banning countries where this Indian variant or Delta variant is prevalent. No? As long as we implement properly the quarantine procedures that currently we are implementing, no? Napaka-importante noon na talagang we need to monitor all these incoming tourists, even if they are locals, especially if they came from countries where there is already Indian variant as the dominant variant.
So you're saying hindi kayo din sang-ayon dun sa shortened quarantine period because yung pong fully vaccinated in the Philippines, supposed to be tomorrow, magiging 7 days na lang po yung quarantine. What do you think should the quarantine period be? Whether meron po bang classification vaccinated, not vaccinated, coming from a country na may Delta variant, or should it be uniform and consistent, Dr. Solante?
Ang nakita ko dito, pag fully vaccinated ka, you have less of the infection and you have less of this ability to transmit if you are infected, no? So mas meron kang benefit when you get the vaccine. So I agree, mas shortened ang quarantine sa fully vaccinated compared to those who are not yet vaccinated. So I'm into that, Pinky.
Okay, so ganun pa rin, 7 days for fully vaccinated and about 10 plus 4 for hindi po vaccinated. Dr. Solante, just tell us, how concerned are you about this Delta variant? I ask this because, well, obviously, it's more contagious. That's what the reports are saying. And number two, the DOH is saying so far we only have 13 cases. Is this really telling us the real number or the real picture of this Delta variant here in the country?
Okay, so on your first question, really, I'm really this is something that we need to closely monitor, no? Because there are new evidence now that this Delta variant is 60% more highly transmissible compared to the other variants of concern, particularly the UK variant, no? And there are also characteristics of this virus that makes it more stable in the upper respiratory tract, and that's why it can make a lot of this virus inside our body. And that's why it is more highly transmissible, because you expelled a lot of this virus when you are carrying this, no? So it's really alarming, and I don't know how soon can we have the total or the bigger picture of the genomic surveillance of all of those positive. We have the 13 cases, but we need more data, including those latest data on how many of those positive are of these variants of concern.
And very quickly, because of that, do you personally think that face shields should remain?
Yes, I always emphasize that in previous interviews, that face shield is still an important component of our protective equipment, particularly even in the community, especially in areas where you cannot practice physical distance or in enclosed spaces. The face shield is an added layer of protection aside from your face mask.
Dr. Rontgene Solante, I wish we had more time, pero naubos pa po. Naubos na po oras natin. I hope to have you again this week. Thank you, sir.
Thank you, Pinky.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.